The title of this poster is Factors Related to Incidence of Low Back Pain in Healthcare Professionals, a review of the literature. In this country and countries around the world, low back pain is an occurrence in most people's lives. At least 80% of individuals in developed countries report some instance of low back pain during their lifetime. Low back pain can be acute, lasting only a few days, or chronic, lasting longer than 3 months. The causes of low back pain are multifaceted. The pain could be a result of injury or trauma to the afflicted area, or there could be no trauma present. Most pain is reported to be idiopathic, and treatment is prescribed, which involves rest, medication, and possibly flexibility exercises. In healthcare professionals, the incidence of low back pain are reported to be very high, particularly among nurses. The factors influencing low back pain are less precise. However, these factors are important to recognize, as over $1 billion are spent annually on treatment and prevention in the US alone. The purpose of this literature review was to assess the factors that led to work-related low back pain in healthcare professionals and the ability to effectively care for patients. Related literature was searched in PubMed using the keywords healthcare professionals and low back pain. Initially, 600 hits were reported. Studies were excluded based upon the exclusion of keywords from the titles and if they were review articles. 10 articles attained the inclusion-exclusion criteria and were included for this review. The results. The literature review included a large demographic from countries in South America, Africa, Europe, and Asia. The most common factor influencing work-related low back pain was ergonomics. This was a broad term used to encompass body positioning and the demands of physical tasks that were required for the occupation. Two factors which seemed to coincide were coworkers who smoked and who were overweight. Although not as frequently reported, but influential, were factors including depression and stress anxiety at the job and being sedentary at work, mostly sitting during work shift. Kinesiophobia and physical traumas, although thought to be factors, were not major factors in the incidence of low back pain in these healthcare workers. Conclusions. Healthcare workers are susceptible to low back pain due to the long working hours and shifts and movement patterns required of the job. Secondary factors such as exercise, nutrition, and psychological health played roles in the onset and maintenance of low back pain. Additional research is necessary to look further into these factors, as well as mitigating work environments to reduce the prevalence of low back pain in healthcare professionals so that they can provide quality care to their patients.